Thanks very much. I have the unenviable spot of being in the right after lunch slot. I hope you guys had a terrific lunch. We provided a good, nutritious meal for you. So I'm very interested in youth sport. I'm a big proponent of youth sport, and I want to say that up front because I'm also a scientist, and I am very interested in making sure that the things that we're promoting are based on evidence and science. And some of the things that we might think to be true may or may not be. We ought to check that based on the evidence. I also say that to say I'm somewhat of a critic, but I am critical particularly of youth sport because I am very passionate about making that a better setting for kids and their families. One of the things that I think is often thought of as truth, but may not be necessarily backed up by science, is that youth sport prevents obesity. I've taken a look at the literature with my research team at the University of Minnesota, and it turns out not to be so crystal clear. When we've looked at about the 20 different studies that are out there, there's no clear patterns. And in fact, some of the largest studies and some of the studies with the most rigorous methodology and the best measurements pretty clearly indicate that there's no difference in weight status between kids who are involved in sport and kids who are not. And that's an interesting paradox for me as a scientist. In 2000, the U.S. Departments of Education and Health and Human Services recommended youth sport as a way to promote physical activity, systematically getting a broader reach for a larger number of kids. And it turns out that that recommendation is based on sound science. There's a fairly large number of studies that very consistently demonstrate that kids who are involved in sport are more physically active than kids who are not. So there's an interesting paradox there. About half of girls and about 2 in 3 boys report that they are involved in sport, either on a community team or a school-based team while they're in high school. Yet our best available data on physical activity standards suggest something pretty different. Only about 8% of adolescents in the United States meet recommended levels for being involved in physical activity. So there's an important disconnect there, a really eye-opening one for me as a scientist. And I think there are 2 studies that really help shed some light on why what's going on there. So we have some good evidence that kids in sports are more physically active, but they're not meeting those recommended standards. In one study that used accelerometers, which are a small device that you can wear on your waist that objectively and unobtrusively measures physical activity among those who are wearing it, a group of researchers put those on kids while they were at their sports practice. And what they found was pretty interesting. Only about 1 in 4 of those kids across a couple of different sports actually met recommended levels of physical activity during their sports practice. And less than half, or only about half, got even half the amount of physical activity that's recommended. In another study, also using accelerometers, looked at kids who were involved on days when they were involved in sport and days when they're not involved in sport, and estimated that sport contributes about 30 minutes of moderate physical activity. Why? What's going on here? It's less than a lot of people, particularly people who are involved in sport, might expect. What I've observed in some of our research is that in youth sport practices, there's a lot of standing around, a lot of instruction going on, listening to coaches, not being physically active. A lot of standing in line, waiting for their turn to be physically active. So, pretty good evidence that kids who are involved in sport are more physically active, but maybe not as active as we might expect. Diet is another area that we've looked at, and it turns out there's very few studies that have looked at diet comparing those who are involved in sports and those who aren't. But in my opinion, from a public health perspective, there's some ideas in there that, in those findings that are instructive for advancing public health on this issue. And what seems to be emerging, and a lot more research needs to be done, but kids who are involved in sport are more likely to eat their fruits and vegetables and drink dairy, but they're also more likely to consume more total calories overall. They're more likely to eat fast food, and they're more likely to drink sugary drinks, including soda pop and sports drinks. Research that my colleagues and I at the University of Minnesota have done helps shed some light on this situation. When we talked with parents and coaches, we found that practices are often overlapping when a typical family mealtime is. Parents are rushing their kids from work, picking them up, getting them over to practice. And one of the first casualties of that is a regular home-cooked meal. Sports drinks have become almost standard equipment for youth who are involved in sports. They think they need it, when in fact, for the vast majority of kids, that's simply extra sugar and extra salt that they don't need. Recall that sports drinks were developed in order to provide fluids, replace fluids for people who've been exercising and extreme heat conditions and for very long periods of exercise, not for kids who are making sports drinks a regular casual beverage. We also see the bus taking kids from sports events to back home will stop at fast food. Parents routinely bring snacks for a post-game treat. And I can tell you that those snacks are not the orange slices that I and maybe you had when you were growing up. What we see commonly is that those are candy, chips, or pastries, and a sugary drink. We've actually done some research simulating how much energy kids are expending while they're playing sports and how much they might be consuming after with the typical post-game snacks. And in some instances, particularly for younger kids, they might actually be in energy surplus after being involved in youth sport. Think about that for a second. So the other piece that we've done quite a bit of work on is looking at what's available to youth in their environment, in these sports settings. At concession stands, we've done systematic observations in more than 60 different venues across the Twin Cities metropolitan area. And we found that by and large, those concessions are pretty similar. And they're, by and large, particularly unhealthy, with very few healthy options available to people in them. Things like hot dogs and chips, pizza, nachos. Those are the things that we're providing as adults to fuel our young people in youth sports. And it's not simply that this is happening once in a while. For families who are involved in youth sport, they're coming to these venues on a regular basis. They're having to deal with the rush from work to home to practice without a home-cooked meal. And oftentimes people are stopping at fast food. As a coach, I've seen kids show up to my practices with a Happy Meal. And they wolf it down before having practice. Adults are shaping these food environments for our kids. Those are the choices that we're making and the fuel that we're providing for our kids in youth sport. Some of the things that we've been involved with at the University of Minnesota has been helping to document this situation and bring awareness. Because adults are shaping these environments, but does it have to be that way? I think the answer is no. I think we can do better for our kids and for our families. At least 3 things, in my view, need to happen to start moving and making change happen in these environments. Number 1, key stakeholders need to be aware of the food environment that we're providing for young kids. Second, we need to have stakeholders who are involved make a commitment to include health as a part of the mission of youth sport organizations. I think too often health is sacrificed for raising funds, for example. And I've heard the objection raised many times, well, kids won't buy healthy foods. We need to make money for the organization by selling concessions. I've heard the excuse, well, they've run around for an hour, just let them have a treat. Those are the kinds of objections that we need to overcome and work through that, and identify data that really directly speaks to some of those issues. And third, I think we need to provide our volunteers, youth sport organization leaders, parent, coaches, with feasible sets of material to actually be able to implement real change. Changes include policy, guidance, identifying different ways, perhaps, that we can raise funds instead of stuffing our kids full of unhealthy foods. And so trying to move the bar forward by identifying feasible and acceptable ways, not only to get kids more physically active and structure games and practices so that kids can be more active and get more opportunities for kids to have access to healthy foods rather than unhealthy foods, and implement those in ways that are feasible and acceptable to the people who are needing to implement them on the ground. My research team at the University of Minnesota has taken steps in that direction, and we're looking to continue to do that as well. We've documented this situation through systematic observations. We've provided guidelines for leagues and organizations on healthy snacks that kids actually like. And we're working with organizations to identify effective ways of implementing policy. We've changed concessions and demonstrated that not only can you make a healthier concession stand, but you can make money off of it as well. And so all those efforts are leading up to us developing a package of materials to be able to implement them with youth sport organizations and test them. And that's the goal of our research group over the next couple of years. And I think, in general, our goals are all the same for being involved with youth sport. We want to make that a fun, safe, and healthy environment for kids and families to be involved in. And I think that's what we're trying to do with MomsTEAM, and I really appreciate the invitation to come here and share with you a little bit of the work that we're doing on this issue. So, thank you very much.